All right, well, let's go to Calgary. Dr. Craig Jenne is standing by, an infectious disease researcher and Canada Research Chair at the University of Calgary. Craig, good to see you. Always a pleasure.
Hi, Todd.
So what does this mean, do you think? A bit of a reversal. We know the plan had been under fire for a while now, but it will be delayed until the end of September. Your read.
Well, this is a clear reflection of the current COVID situation here in Alberta, where we've seen now multiple days of more than 500 cases a day. We've seen a rise in hospitalizations and, more critically, a rise in intensive care unit admissions. So we absolutely need these tools to begin to identify where the virus is spreading, where the hotspots are, what the trends will look like in the next 2 to 3 weeks. So I think that this is absolutely the right decision to keep these measures, these tools in place, at least for the foreseeable future here in Alberta.
Do you think the province moved too quickly, Craig, when they first announced that they were going to end all of the health measures involving COVID?
Yeah, I think there was a lot of concern that we did see circulating variant in the community, and reducing screening and testing and isolation among the other lifting of restrictions here in Alberta, where essentially there is no longer indoor mask or capacity limits, didn't seem to make a lot of sense. That if we're going to lift restrictions, we need that testing, we need that tracking to remain in place to understand what the impact of changing those public health measures actually results in the real world.
How about your take on the back-to-school measures in Alberta, the fact that masks will not be required in schools? Right move or not the right move?
I think it's difficult to say. There are, differences across the province. I would have liked to have seen a little bit more guidance from the province itself, although they did make it extremely clear that individual school boards and districts are free to make those decisions for themselves. I think, though, that does leave an air of confusion, and we might, for example, see in the city of Calgary, multiple school boards bringing in masks, whereas others do not, despite the fact they're in the same risk group for virus in the city. So I think there will be some confusion with parents, and given that these children, mostly under the age of 12, do not have access to vaccines yet, we really do need other public health measures to help keep them safe.
Let me ask you as well, federally, if we can, this big news. The government will require all federal employees to be vaccinated by the end of October. That's about 500,000 people, Craig, and then also asking federally regulated industries like banks, telecommunications, media to also push for that privately. And also flights within Canada. People who get on a plane as of the end of October will have to prove they've been vaccinated. And if you get on a train, let's say you are traveling to BC, Craig, and you take a train to Vancouver, you're going to have to prove you've been vaccinated as well by the end of October. Does that make sense?
Well, this is, again, I think, a very clear reflection of where we stand in the country with COVID, with rising cases in multiple provinces, that clearly the vaccine rate we've achieved in a number of areas, for example, here in Alberta, is not high enough for community protection. We simply do not have that fire break to stop the virus from moving around. Within Canada, it could be one issue whether vaccine passports